Atrial fibrillation affects millions of people in the United States, and until now, people who suffer from it have been limited on treatment options. St. Vincent's Medical Center in Riverside has an innovative procedure that's helping patients out with A-Fib. I met up with Dr. Oza to learn more about it. Dr. Oza, what exactly is atrial fibrillation?
So atrial fibrillation is the most common arrhythmia in humans. Essentially what happens is that the top chamber of the heart, or the atria, instead of beating 60 to 100 times a minute on average, beats 400 to 500 times a minute. And essentially, instead of squeezing in sync with the bottom chamber of the heart, just starts to fibrillate. And that's essentially what atrial fibrillation is.
And is this something that's going to grow in time?
Over the next 20 years, we expect it to grow dramatically with the aging of the population, as well as a lot of the other diseases people have that are associated with obesity, which is also an epidemic here in America. We really do expect this to be a burgeoning health crisis.
So if someone does have A-Fib, what are their treatment options?
So for many years, our only option was either controlling the rate of patients that have atrial fibrillation, so we want to control their heart rates to minimize their symptoms, or use medications that can potentially hold them in normal rhythm. The problem with both these methods is that, first of all, with rate control, you often don't get complete resolution of the symptoms. People still feel symptomatic with their atrial fibrillation. With the rhythm control or the antiarrhythmic medications, you have a lot of risks associated with them. The side effects from the medications can be very severe, ranging anywhere from fatigue all the way to cardiac arrest or sudden cardiac death. So what they found is that these medications don't actually prolong life, or often don't work quite as well as we'd like them to. So that's what we've had in the past. Now what we have is a whole new set of interventional options. Catheter ablation is the most common of those, where we can actually take a catheter, go in through a vein in the leg, and cauterize areas of the heart that are causing atrial fibrillation, and thereby keeping people in normal rhythm without using these medications long term.
And is this the convergent clinical theory that you guys are doing right now, or?
So the convergent procedure is actually a procedure we use for more advanced atrial fibrillation. So catheter ablation works best for patients that have what's called paroxysmal atrial fibrillation, or atrial fibrillation that only comes intermittently. It comes and goes on its own, meaning that people go back into sinus rhythm without us having to intervene. When you move on to persistent atrial fibrillation, or people that remain in atrial fibrillation long term, more than a week all the way up to a year, that's called persistent, we don't have as great success rates. We've always been looking for something for those patients. That's where the CONVERGE trial comes in. The convergent procedure currently we really use for the long-standing persistent atrial fibrillation patients. Those are the patients that have had constant A-Fib for over a year. And those patients have a lot of different areas that their A-Fib is coming from in the heart, and we have to use more advanced techniques. What the CONVERGE procedure is a hybrid of a surgical procedure as well as a catheter-based procedure. It's very minimally invasive. The cardiac surgeon essentially makes two small incisions just under the chest bone, so it's not considered open heart surgery, and they put a camera as well as a catheter and cauterize on the outside of the heart areas that are causing atrial fibrillation, and it's all areas in the left upper chamber of the heart. And then we soon after, during the same procedure, go in from the leg and cauterize areas from the inside of the heart using our catheters that they can't get to. And thereby you get a complete set of lesions that are kind of the best of both worlds. And with that, we've seen that even these long-standing persistent atrial fibrillation, the most advanced atrial AFib patients, have excellent success rates.
Now, is this a pretty innovative type of surgery that you guys are doing?
It is. There's not a lot of places around in our region or even in the state that do this procedure or do a lot of this procedure. Most of these patients, unfortunately, that have long-standing atrial fibrillation are just left to deal with their symptoms of atrial fibrillation and use what I discussed before, rate control, in order to keep their heart rates down, because we really didn't have any great treatments for those patients in the past. So there's many, many patients out there with that condition. This is kind of a new procedure, this is a new tool in our armamentarium that allows us to treat these very advanced AFib patients.
And you guys right now are conducting clinical trials with this procedure. So what exactly does that mean?
So what the CONVERGE trial I think is best suited for are those patients in between, where we're not sure exactly what the best answer to those patients are. The patients that have had anywhere from a week of AFib all the way to a year of AFib. In that range, sometimes I take that a little further for the trial, even to 1 to 2 years if they have a structurally normal heart. Those patients we're not exactly sure what the best treatment is. And we think that, you know, potentially this convergent procedure could be a good option for them. So this allows them to have access to that type of procedure even at an earlier stage because we've seen such great results at even a later stage of atrial fibrillation.
Well, thank you for all your time and information, Dr. Oza. I appreciate it.
Thank you so much for having me.
To learn if you qualify, visit afibclinicaltrial.org or call 904-758-6250.